We always talk about how Mila's probably going to be the toughest kid on the street because of everything she's gone through, but I also think that's why she's so laid back about things, is she's gone through so much and very little phases her.
Olive had been through multiple different treatment options over a span of years, and sometimes it was a lot to manage.
But she handled it like a champ.
Gabby is her own person in every sense of the word, and this time with this treatment, that resilience has sort of carried us through.
It was a little terrifying to know that your child was going on a trial and you weren't sure exactly what was going to happen. But what they could tell us was information that we could kind of wrap our heads around, and we felt comfortable with it. So we decided to trust the care team once more and decided to go ahead and give the trial for OJEMDA a shot.
What is OJEMDA, tovorafenib? OJEMDA is a prescription medicine used to treat certain types of brain tumors, cancers, called gliomas, in people 6 months and older. That is a pediatric low-grade glioma, LGG, and that has come back after previous treatment or has not responded to previous treatment, and that has a certain type of abnormal BRAF gene. What are the possible side effects of OJEMDA? OJEMDA may cause serious side effects, including bleeding problems, hemorrhage, skin reactions, including sensitivity to sunlight, photosensitivity, liver problems, slowed growth in children. The most common side effects of OJEMDA include rash, hair color changes, feeling tired, viral infection, vomiting, headache, fever, dry skin, constipation, nausea, acne, upper respiratory tract infection.
Gabby experienced rash, nausea, vomiting, fatigue, and perhaps most noticeably, hair color change.
Mila did have some side effects while she was on OJEMDA. She did have a rash that would cover her body and her face occasionally. She had sensitivity to sunlight. She did have slowed growth. She would get nauseous and would throw up a lot when she was really hot.
I think it was a couple of weeks in when she started to get the rash, but we stayed in really close contact with the care team. We had a number of different creams and ointments that she needed.
We did a lot of bleach baths, which sounds wild, but it's just a bath with a little bit of bleach in it.
She was not a fan.
Not a fan, especially not a fan of doing all the creams afterward. So we had to be creative about how to get her excited about the baths on really hard days. One time I had a whole glow set up in the bath with funky music and balloons and glow sticks and stuff. We also, had times where we turned it into a spa with aromatherapy and just relaxing.
One of the side effects that I mentioned earlier is that Mila would get nauseous and she would throw up. This would especially happen when she was hot, when she would get overheated and she'd been in the sun for too long, but it wasn't always that simple. I appreciate my daughters both so much, but my daughter Ava, Mila's younger sister, who's about 1.5 years younger than her, would be kind of my alarm system. We would be sitting on the couch together, and before I could even notice that it was happening, Ava somehow had this sixth sense that Mila was starting to feel sick, and she would look at me and say, "Mommy, go get the throw up bucket. Mila's about to throw up," right? So it was horrible, right? But it was amazing to watch Ava be that caregiver for Mila and be so attuned to what was happening with her when she was starting to get sick.
Olive, she also had pretty severe sun sensitivity.
Yeah, sometimes it took a little extra prodding, but we tried to get her out and about by taking precautions. We even went to Hawaii. We did a lot of fun stuff, so it was something that was tolerable for our family.
The side effect that is clearly the most notable would be the white hair.
And white eyebrows and eyelashes.
The hair color change was an impact. It didn't bother her as much. I will say her eyebrows and her eyelashes did bother her. She felt a little strange about those. And as a mom, you always want to protect your kids. And so I was so worried that, she was in 4th grade, going into 5th grade. It was her last 2 years of elementary school. And I was so worried the kids would make fun of her because her hair color was changing. I will tell you, it was almost the exact opposite. Kids thought it was so cool. She always looked gorgeous no matter what. She's so sweet from the inside, and that just radiates.
Olive really leaned in on the white hair.
People would suggest that she could dye it fun colors or something like that. And she was like, no, it's awesome.
Gabby embraced this change of hair color, and she took that change of hair color just like anything else, and she just rolled with it. We called her a superhero.
One of the lesser known side effects while Milo was on OJEMDA was slowed growth. It's really hard to notice that, right? When you're with your child every day, you don't really notice that their growth has slowed. But throughout her treatment, they did do measurements on her height. And although we didn't really pay attention to it, we noticed that it was slowing. After about 3 months of stopping treatment, we noticed that Milo was growing again. And at about 9 months, she was catching up.
It meant so much for us for Olive to be able to take the medication once a week at home, with or without food.
She had 5 really large pills that she had to take once a week. But the once a week piece was really important to us because we didn't have to shuttle back and forth between the hospital anymore.
When you're dealing with a brain tumor, doing nothing is often not an option.
When we came along this of the opportunity to try an investigational drug, we felt like we had to take that chance. And part of why we took that chance is because we knew that other families along the way had taken this same chance, so that the drugs Gabby had already taken had already been through the investigational process, were already FDA now approved because somebody else said yes.
Honestly, it just felt really good knowing that we were going to be helping move pediatric brain tumor research forward.
If I were to talk to another family who was considering OJEMDA, there's a few things that I would tell you to consider. Number 1, trust yourself and understand that you know your child better than anybody else. Make sure that you are asking the questions that you need answers to so that you feel safe and you feel educated and you can advocate for your child.
You have a voice in this process, and don't be afraid to use that voice to share your concerns or things you may have come across and share with your care team so that you together can make those decisions.
And number 1 piece of advice is you are going to be your child's greatest advocate.
Indication. What is OJEMDA, tovorafenib? OJEMDA is a prescription medicine used to treat certain types of brain tumors, cancers, called gliomas, in people 6 months and older, that is a pediatric low-grade glioma, LGG, and that has come back after previous treatment or has not responded to previous treatment, and that has a certain type of abnormal BRAF gene. Important safety information. Before taking or giving OJEMDA, tell your healthcare provider about all of your or your child's medical conditions, including if you have bleeding, skin, or liver problems, are pregnant or plan to become pregnant. OJEMDA can harm your unborn baby. Females who are able to become pregnant, you should use effective non-hormonal birth control, contraception, during treatment with OJEMDA, and for 28 days after your last dose of OJEMDA. Males with female partners who are able to become pregnant should use effective non-hormonal birth control, contraception, during treatment with OJEMDA and for 2 weeks after your last dose of OJEMDA. Are breastfeeding or plan to breastfeed? Do not breastfeed during treatment and for 2 weeks after your last dose of OJEMDA. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking certain other medicines can affect how OJEMDA works and may increase your risk of side effects. OJEMDA may also affect how other medicines work. What should I avoid while taking OJEMDA? Limit the amount of time you spend in sunlight. OJEMDA can make your skin sensitive to the sun, photosensitivity. use sun protection measures such as sunscreen, sunglasses, and wear protective clothes that cover your skin during your treatment with OJEMDA. What are the possible side effects of OJEMDA? OJEMDA may cause serious side effects, including bleeding problems, hemorrhage are common and can also be serious. Tell your healthcare provider if you develop any signs or symptoms of bleeding, including headache, dizziness or feeling weak, coughing up blood or blood clots, vomiting blood or your vomit looks like coffee grounds, red or black stools that look like tar. Skin reactions, including sensitivity to sunlight, photosensitivity. OJEMDA can cause skin reactions that can become severe. Tell your healthcare provider if you get new or worsening skin reactions, including rash, bumps or tiny papules, acne, peeling, redness or irritation, blisters. Liver problems. Your healthcare provider will do blood tests to check your liver function before and during treatment with OJEMDA. Tell your healthcare provider right away if you develop any of the following symptoms: yellowing of your skin or your eyes, dark or brown tea-colored urine, nausea or vomiting, loss of appetite, feeling tired, bruising, bleeding, pain in your upper right stomach area. Slowed growth in children. Growth will be checked routinely during treatment with OJEMDA. The most common side effects of OJEMDA include rash, hair color changes, feeling tired, viral infection, vomiting, headache, fever, dry skin, constipation, nausea, acne, upper respiratory tract infection. OJEMDA may cause fertility problems in males and females, which may affect your ability to have children. These are not all the possible side effects of OJEMDA. Call your healthcare provider for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Day One Biopharmaceuticals at 1-877-204-2820. Please see full patient information, including instructions for use, for more information.